Hello, and welcome to this recorded webinar titled Naloxone and Other Opioid Reversal Medications, What You Need to Know. I'm your presenter today, and my name is Elizabeth Skoy. I'm a professor at the North Dakota State University School of Pharmacy, and I'm also the director for our Center for Collaboration and Advancement in Pharmacy. I have no disclosures to disclose today. Our learning objectives are to first describe how opioid overdoses occur and appropriate responses, review available opioid reversal agents, and also explain how pharmacists can recommend opioid reversal agents to patients and effectively educate them on their use. So to start, we're just going to do a brief overview and recap of opioids and how they're a very effective pain medication. So as you can see here, the little blue dots with the numbers are all the different areas where opioid receptors, or the mu receptor, is located throughout areas that respond to analgesia. So you can see that there's a number of areas in our brain as well as our spinal cord where opioids will bind to receptors and then have a very strong effect on reducing pain. However, those opioids are not selective in the fact that they also will bind to other opioid receptors or mu receptors throughout the body. And this particular slide really highlights how those opioid medications will kind of specifically target or lead to individual side effects. And so as you can see here, there's a number of receptors throughout the brain as well as even in the carotid body, which will lead to having an effect on our lungs. And that can lead to respiratory depression or someone's inability to breathe. So opioids cause respiratory depression. Also, opioids do lead to dependence, withdrawal, or reward, and euphoria. And those are located throughout the particular green circles with numbers in our brain. And so that obviously can lead to dependence or potentially misuse of opioids. Opioids also cause sedation, they can cause convulsions, and even work in our gastrointestinal tract, and that can lead to constipation. They can also lead to nausea and vomiting and then diuresis. So as you can see, these are all the different particular areas in which when opioids bind to the opioid receptor can lead to those side effects that can kind of be inconvenient for patients, such as constipation, nausea and vomiting, but they can also potentially lead to death through an opioid overdose, which we'll get to here in our next slide. So this slide kind of goes into how an opioid overdose can be recognized. So based off of the previous slide, kind of see how when those opioids bind to particular receptors in our body, that can lead to the actual happening of an opioid overdose. And so knowing what that overdose can lead to will help us also recognize those signs and symptoms of an overdose. And so some particular signs of overdoses when someone's not responding, right? So there's that sedation. And so if they can't be if they don't move or they really can't be woken, that can be a sign that someone's in an opioid overdose situation. Also, we talked about how opioids can have an effect on the lungs and cause respiratory depression. And so if someone's not breathing at all, or their breathing is very slow and shallow, that can also be a sign of an opioid overdose. Also, sometimes people are making choking and gurgling sounds or maybe even snoring really loudly. There's also examples of someone's lips turning blue or their nails particularly turning blue. Again, that can be a cause from that respiratory depression and lack of oxygen in the body. And have cold and clammy skin, and then tiny pupils. So these are all individual signs of opioid overdose, and in someone that's in an overdose situation, you may see, one or multiple of these particular signs and symptoms. So before we get to what it is and how we're going to, and we can respond to that overdose, we're going to do a brief knowledge check. So opioids can have an effect on which parts of the body? The brain, the lungs, the gastrointestinal tract, or all of the above. I'll just give you a moment to think about that. And our answer here is all of the above, right? So we already talked about how those opioids can have effect in our brain, also affect our lungs and the body's ability to breathe, and then also can have effects in our gastrointestinal tract, because we talked about that constipation. So now that we've talked about how an opioid overdose can occur, now we'll talk about how we can respond to that opioid overdose and have a reversal. And this is an example of how naloxone works in the body, but however, at the time, all currently available opioid antagonists work in this exact same way. And so there's an example of how the little green, receptors, those are the opioid receptors on the brain as well as other parts of the body. And you'll see those. And then the little pink balls are going to be the example of the opioid. So when someone consumes an opioid, they will go ahead and that opioid will attach to that receptor. And that's when someone's going to be experiencing the analgesia that they're looking for, as well as some of those other side effects or the effects of the opioid that we previously talked about. However, when someone is then given naloxone or an opioid reversal agent, that naloxone, which is signified by the green bumpy balls, that actually has a stronger affinity for that opioid receptor. And so the naloxone and opioid antagonist will actually displace the opioid from the opioid receptor. And that will then lead to kind of the effects of opioid, the reversal of those. And so with that, it's also important to note that when someone is given an opioid reversal agent, they will, and let's say they're unconscious and they wake up and that the opioid reversal agent works. However, since that opioid has been cleared from those receptors, they're also going to be waking up with side effects, right? So they're going to be probably waking up and they will be experiencing pain if they had been taking that opioid for pain, because that opioid is no longer working in the body. And they'll also be experiencing other potential side effects like withdrawal. And based off of patient testimonials and sharing of what it's like to be in an opioid withdrawal, it's kind of described as maybe the worst flu possible. So you have body aches, you have nausea, you have you feel horrible, you wake up in pain, all of those, and these horrible withdrawal symptoms. And of course, the alternative to not having that is, no longer being alive, right? Because what we're giving an opioid reversal agent to save someone's life to restore the body's natural ability to breathe. But those withdrawal symptoms are real, and it's also just important to be aware of that as we talk about the different opioid reversal agents that are available on the market, which we'll get to here in our next part. So this particular slide really highlights kind of the classic naloxone dosage forms that were available before some of the more recent prescription naloxone and layperson naloxone dosage forms became available. So of course, there's the kind of tried and true, been around for a really long time, injectable naloxone. That's available in a 0.4 milligram per milliliter, and you inject that particular medication, ideally intramuscularly, 1 milliliter. And with this, you need to also dispense needles and then a syringe. Typically, in order to provide injectable naloxone, somebody needs some sort of training. So that's not really associated with layperson. So usually those individuals who are providing injectable naloxone need, instructions on how to draw up the medication and how to administer the medication, because not everybody will be comfortable utilizing those needles and those syringes. And then this is also available in, the injectable naloxone is available only as prescription. Then we'll get to kind of, this is the intranasal generic version, and this was available through before kind of the next dosage forms that we're going to be talking about in a little bit. The intranasal naloxone branded came available. And this was utilizing a pre-filled glass syringe of naloxone and then utilizing an atomizer being attached to that syringe and converting it from an injectable dosage form into an intranasal dosage form. This really isn't seen quite as much because you have to actually, the atomizer typically isn't covered under insurance, and it's a little bit more cumbersome to administer intranasal, but I do want you to be aware of that it still is used in some places. And so for this, because the nostril can really only absorb a milliliter of uh, of liquid at a time. You're actually gonna, and the syringes come as like and the atomizers come as for administering 2 milliliters. You actually spray half of the syringe, which is 1 milliliter, into one nostril and repeat that for the other nostril. So there's also now kind of more user-friendly or considered to be more layperson appropriate naloxone. This is also a prescription. It's called Zimhai, and that's an injectable. And this comes in a 5 milligram per 0.5 milliliter. And so you'll notice here that the strength is a little bit different than the other ones that we talked about. This is approved for individuals 12 years and older, and it can be administered subcutaneous and intramuscular. So this is also injectable. It's marketed more, again, to be available for layperson use, in the fact that the syringe and the liquid or the medication itself is already pre-assembled into a device, and then it kind of, you'll see here how there's symbols and as well as instructions on how to use that. So I would kind of put this similar to maybe like an EpiPen or something like that, that although it's an injectable, it's marketed as layperson friendly and easy to use. And so this is also available on the market right now. And then we also have 2 formulations of naloxone that are available over the counter. And so the first is that 4 milligram per 0.1 milliliter, and that is approved for over-the-counter use. And this is the classic intranasal where you would spray just one device in one nostril. With all naloxone, it should be noted that you should always dispense 2 doses of naloxone. So whether you'll see here in the picture that there's always those 2 devices or 2 doses, or if you're providing the 1 milliliter liquid vials of naloxone that I've been previously discussed, you would always provide 2 of those along with 2 syringes. And the reason that is because if you kind of can think back to our image that we showed earlier where the opioid reversal agent is attaching to the naloxone receptors, although the opioid reversal agent has a stronger affinity for the opioid receptors, sometimes it can have a shorter half-life. And so what's going to happen is that eventually the opioid reversal agent is going to be excreted from the body through the half-life and the kinetic process. But the opioids typically have a longer half-life. And so what can happen is you can actually put someone in an overdose situation and they can actually go back into overdose before EMS arrives. And then the other example is that sometimes it takes more than 1 dose even to revive somebody. And so what we usually will say is you administer 1 dose of naloxone, then you wait a couple of minutes, and if there's still no response, you would go ahead and administer the second dose. And so these intranasal devices are approved for layperson use. They're relatively easy to use, and again, you just spray 1 device into 1 nostril. Although if you do have to repeat the dose and give the second dose, you would actually go ahead and repeat that and place it in the second nostril. And there's also a couple of other naloxone dosage forms that are available and intranasal, and they're in various dosage in doses. And so there's a 2 milligram per 0.1 milliliter, and then there's actually an 8 milligram per 0.1 milliliter, which is double the strength. The kind of the reasoning between, or at least for the stronger strength, and the theory behind that is that the stronger strength of naloxone, it might be more effective for like overdoses with higher concentration of opioids, such as something with fentanyl. And so that was kind of the reason higher doses or medications like synthetic opioids might require a higher dose of naloxone. And that was kind of the intention of creating the higher strength of naloxone. And so we're going to get to that here in just a moment and talk about that a little bit more. But I do want to highlight that these 2 intranasal naloxone or Narcans are actually considered to be prescription. They are not over the counter as the ones I previously mentioned. Now, more recently, there's been an opioid antagonist that has come back on the market, and that's Nalmefene. Nalmefene used to be on the market, then it was pulled off the market by the manufacturer, and then once the opioid epidemic kind of came to a full head, it came back on the market. Nalmefene is available as an injectable, and it can be used by sub-Q IM, or it's more commonly used in emergency room departments in the IV form. And then it also comes in an intranasal medication as our intranasal administration as well as a 2.7 milligram per 0.1 milliliter. And it's this in the same device that's utilized in intranasal naloxone. One thing just to keep in mind is that there are some differences between Nalmefene and naloxone. So one of those is that Nalmefene has a higher binding for the opioid receptors. It's actually 4 times greater of affinity for the opioid receptor than naloxone, and it also has a longer half-life. It has a 7-hour half-life versus naloxone, which is at a 2-hour half-life. So because of this, because of the higher affinity and also for that longer half-life, it is more likely to experience withdrawal, which we'll get to in a little bit here in more detail. And then also Nalmefene does have a slower onset of action than naloxone. It has about a 5-minute onset of action versus a 2-minute onset of action for naloxone. So that's also to keep in mind, right? So we usually say like 2 to 5 minutes to wait before you readminister. And so for naloxone, you might be readministering closer to the 2-minute mark if someone doesn't have a response. But Nalmefene, you might want to wait closer to that 5-minute mark before someone has a before you administer based off of someone's response. And just because Nalmefene has a longer half-life as well as a greater affinity for the opioid receptor, that doesn't mean that individuals don't need to be monitored in the emergency department. In fact, Nalmefene, because of that longer half-life, usually will result in a longer emergency department visit because of that longer half-life. So they have to stay in the emergency room longer to see if someone's going to need to re-administer the Nalmefene again based off of their overdose situation. And then just, to reiterate kind of the reason Nalmefene came back on the market in this form, as well as that higher dose naloxone we just talked about, is that theoretically, and the way it's kind of marketed is that it's better to theoretically be more ideal, I should say, for individuals that have consumed synthetic opioids or really high dose opioids. But we'll get to that here in a moment as to if it's actually better or not. So here's an image of a reminder of how to administer intranasal naloxone. Again, since that's the most common dosage form that's available for naloxone, as well as the Nalmefene, as we just mentioned, for layperson use. And all you do is you insert the device into the patient's nostril and you press up on the plunger. And again, you administer one device in one nostril, and then if you do need to repeat that dose of the opioid antagonist, you would utilize the second device in the other nostril. So really straightforward. Now we're going to go through and highlight appropriate opioid antagonist education. So although some of the examples in here are set to have naloxone for ease of use, realizing that the same type of education will go for Nalmefene as well. So it's always important to recognize that 911 should be called before or after delivery of the opioid antagonist. And that is, again, because although somebody might be rescued and they might seem like they're fine, they could go back into that overdose situation. So it's important to get emergency services to that patient and get them transported and get the care that they need as soon as possible. It's also important to know that the person that's administering the naloxone has had proper education if needed, although a lot of the newer products are available for layman use, but there are patient handouts available from the one program as well that you can provide with that naloxone. It's also, again, important that if there's no symptom improvement within the first couple of minutes, that individual should be provided a second dose, and we did talk about that already. And for adverse effects, those withdrawal symptoms, it's important that individuals know what the adverse effects might be from the naloxone if they are to administer that. And so when somebody comes up and they're not feeling well, or they have nausea, body aches, that's a normal side effect of the medication. It means that that medication is working for the opioid reversal. In addition, highlighting those storage conditions. most of the more current products do allow for excursions out of those normal room temperature. So more, slightly cold, cooler, or slightly warmer conditions. However, it's also important to know that this isn't something that's going to be able to be stored in a glove box during a North Dakota winter, well below freezing. So it's important to be aware that storage conditions and how that particular medication can be stored. Always important to highlight the shelf life. If that medication has expired, it's important to replace the opioid reversal agent with a newer medication to have on hand. And then it's also important to highlight the safety information, that even if somebody has not experienced an overdose and you provide them with the opioid antagonist, there is no safety concern. So if I were to consume naloxone or nalmefene intranasally or injectable right now, I wouldn't experience any side effects. It would almost be like I didn't really have anything. It would almost be like I had a placebo effect on, or placebo of the medication. It really only has the effect if that individual has had naloxone on board. So if somebody comes across somebody that has those symptoms and signs of an opioid overdose, it's not going to harm them to provide that opioid reversal agent. And then no matter how many times you provide these medications, they do not produce tolerance like you would sometimes obviously see within opioids themselves. It's also important to recognize how it's best to recommend naloxone for individuals. So for instance, if you've provided a one program screening for that individual and you think that they should have naloxone or nalmefene at home, you can state based off of this, based on the fact that you're also taking a benzodiazepine, or based on the fact that you have a history of COPD and you're taking a benzodiazepine that puts you at a higher risk for an opioid overdose, and therefore we think you should have naloxone on board. So we found that explaining to patients why it is that you think they should have naloxone helps with acceptance. We can also state that really anyone that has an opioid has some risk of overdose. So it doesn't matter who you are, anyone that consumes an opioid has a risk of overdose. And so having naloxone on hand could help save a life if you were to experience an overdose. And always identifying these opioid antagonists as a safety precaution. So using a seatbelt analogy or a fire extinguisher. We think that you should have this naloxone on hand in the hope that you never have to use it. It's similar to a fire extinguisher. You have a fire extinguisher in your home for safety in case there was an emergency to occur, but you hope that you never have to use it. In the same way is why we're recommending naloxone for you. So using those analogies can really help with patient acceptance as well. And then also there might be questions or concerns with responding to an overdose and highlighting Good Samaritan laws in your own state or your own area. And almost all states have some sort of Good Samaritan law that if you respond to an overdose or you try to participate in a rescue, you are protected from prosecution. So we'll now go to our final knowledge check. Once naloxone is given and a patient responds, emergency medical services are not needed. I'll give you just a moment to answer that on your own. Okay, and of course that answer is false. So even if naloxone is provided and a patient responds to the medication, you still do need to contact medical services. So with that, if there's any questions you have on naloxone, nalmefene, opioid reversal agents, please contact the One program. We'd be happy to answer those questions for you, and we will now provide your continuing education code and information. Thank you.